Okay, so my name is Jacqueline, I'm midwife, and I'm going to be taking you through the procedure of PPIUD insertion. There are three actually different types of insertions. There is a manual insertion, there is an instrumental insertion, there is also IUD insertion using the long special applicator for postpartum IUDs. But for the sake of this video, we are going to be concentrating on the instrumental PPIUD insertion. And now we have come to inserting the PPIUD. So we have a number of instruments or requirements that we need for this procedure. Number one, we need a Sims speculum. This is our Sims speculum. We need a sponge holding forceps. We need special Kelly post-placental forceps. Or sometimes we do not have the Kelly forceps, we can also use ring forceps instead, but we would prefer to use Kelly forceps because they're long and they make the procedure easier for you. All these are sterile instruments. And then we have swabs in a disinfectant solution. And then we have our high-level disinfected gloves, sterile gloves. And then we also have a piece of towel for placing on the mother's abdomen because we shall be trying to maintain a septic environment. So we need not to be touching the mother's abdomen. Remember, we have to elevate the uterus at some point as we're doing this procedure. So as we're touching on the abdomen, we do not need to be touching the abdomen using our sterile gloves. And then finally, we have our PPIUD. So this is our IUD that we shall be using for this procedure. And then also finally, we need to have the mother. We need to have the mother positioned in a lithotomy position, and we need to have her positioned well, and of course we should have some drapes underneath her buttocks. So that is all we need for the procedure. So let's dive in to the procedure. Okay, so having set everything ready for the procedure, and we have also washed our hands and worn our sterile gloves, we will now start the procedure. So we will get our Sims speculum and gently insert the Sims speculum to visualize the cervix by depressing the posterior wall of the vagina. So we gently insert our Sims speculum. And then we are going to go ahead and clean the cervix and the vagina with antiseptic solution. So this is our piece of gauze with antiseptic solution in it. So we shall clean the cervix and the vagina. And discard. We are going to do this twice. As we come out. And since that is done, we shall set our sponge holding forceps aside. And then we are going to use our sponge holding forceps to gently grasp the anterior lip of the cervix. So having done that, we are going to open our sterile package of the IUD. All right, so we are going to open our IUD from the bottom of the packet. So we shall open it all the way up until we have opened up to a third of the packet. Up to about here. So what we are going to do is, with our less dominant hand, we are going to stabilize the IUD so we can remove the plunger and the rod and the card from the packet. So we shall remove the plunger, we put it aside because we do not need it for this procedure. For this procedure, we already said this is instrumental, so we don't need the insertion rods and the plunger here. Also, we shall remove the card so that we're only left with the IUD in the packet. Notice I am not touching the IUD. My sterilized hands are touching the IUD packet. All right, so we are going to use our dominant hand to pick the instrument, the Kelly forceps, and open the Kelly forceps. So with our non-dominant hand supporting the package, we will gently pick the IUD from its pack. So we want to pick the arm of the T gently. This, making sure we are keeping the strings and they are not entangled. So we shall gently come and insert our IUD. So remember we said this is a non-touch technique. So the IUD should not touch the surrounding of the mother, should not touch the seams speculum. Also we should ensure that it's not touching the walls of the vagina as you're inserting it. So we are going to hold our ring forceps or our sponge holding forceps, which is clamping the anterior lip of the cervix. So gently we are going to insert the IUD, making sure it's not touching anything. So we shall advance it slowly until we feel a bit of resistance. So where we feel the resistance, we are going to pause just a bit. So at this point, we do not need our sponge holding or ring forceps, so we shall remove them. So we remove and we set it aside. And then at this point, we now want to make sure we progress. But remember we said when we feel resistance, it shows that we've reached the back wall of the lower segment of the uterus. So still here we are keeping our forceps, which is holding the copper T, closed so that we don't lose the IUD before we reach the fundus. So here we need to elevate the uterus because there is a vaginal uterine angle which is quite sharp, so it doesn't allow you to further smoothly progress. That's why you're feeling resistance here. So we need to reduce that angle. So by elevating the uterus, we will flatten that angle so we can progress. So by elevating, we mean placing that less dominant hand at the base of the lower part of the uterus. That is just above the pubic bone, with our fingers facing towards the fundus. And then we will gently push the uterus upwards in the abdomen so we can extend the lower uterine segment and reduce the vaginal uterine angle. So when we do that, we can now gently progress with our IUD. So we will progress with our IUD until we feel resistance again. So at this point, my dominant hand has now reached the perineum, as you can notice. Also, you can be able to feel the end of the Kelly forceps, you can be able to palpate them. You can be able to palpate the resistance with your fingers up here. So when you do that, we are now going to release our IUD. But now we have to be gentle. Yeah, because if you're using lots of force, you can be able to cause trauma or even to perforate the uterus. So we shall now open our Kelly forceps to release the IUD. So we do this gently and with skill and technique. So when we release the IUD and we are sure it has been released at the right spot, we will slightly move our Kelly forceps to the side. Why we are doing this is because we do not want to dislodge the IUD from the right position where we've put it. And then while keeping the Kelly forceps slightly open, we will now remove it gently while moving along the side of the uterus so that we do not grasp the IUD and come with it. So we shall gently remove our Kelly forceps and set it aside. So you can notice that I kept stabilizing the uterus until I removed the Kelly forceps. After doing that now, we are now going to go ahead and examine to see if our IUD has not come out with our forceps. Also, we want to ensure that we actually didn't leave it just somewhere around the vagina, or it has come out and being misplaced. So we will just examine to see if the IUD is here or the strings are very long and protruding outside. So now here our IUD has been placed properly. We cannot see it protruding inside the vaginal canal, and also we only see the strings protruding from out of the cervix. So that indicates that we have correctly placed our IUD. So then we can remove our Sims speculum, and we will clean the mother, and we can be able to remove this towel that we had placed for sterility. And then, having finished the procedure, we will make sure we collect all these instruments that we had used, and we discard them off in 0.5 chlorine solution for decontamination. And also we want to ensure that we dispose other wastes appropriately. We know which goes to the non-infectious bin, which goes to the infectious bin, and which goes to the highly infectious bin. And then after that, I am going to remove my gloves and then perform hand hygiene. So having done that, I need to inform the woman I've completed the procedure, and I need to give her post-procedure counseling, and then also I need to document what I have done and also give her a copy of the documentation, that is her card. And then I also keep a copy of my documentation in the patient's file or the book where we record it, and that is the end of the procedure. Thank you.